Hello everyone, this is Dr. Kant Shah, Pediatric Robotic and Laparoscopic Surgeon. This video in our series of Pelvi-Ureteric Junction Obstruction is going to discuss the recovery after the surgery called pyeloplasty, the follow-ups that are expected to be done, and the long-term outcomes for children who undergo this procedure. I want to emphasize that surgery is only one step and proper follow-up after the surgery is equally important to protect the kidneys in the long term. So how is the immediate recovery after a pyeloplasty? Well, most children recover very quickly, particularly since we only do laparoscopic or robotic surgeries nowadays. The pain is usually very mild and well controlled with simple analgesics, and the feeding and normal activity resume within a day or two. The hospital stay is about 3 to 5 days, and once the baby is comfortable and there is no sign of an infection, the baby can go home. The parents are given clear instructions. If the baby is small, then an antibiotic may be continued until the stent is in place. So what should parents expect when the baby gets home? In the first few days, some discomfort or tiredness is common, but usually by a week, the activity would increase to normal and normal play is also allowed. We would request the parents to not send the child to school for about a week and not play any active sports up to a month after such surgery. The first follow-up is 1 week after surgery where we remove all the dressings. Usually there are no stitches to be removed. 1 month later, an X-ray and an ultrasound scan are done to ensure that there is no obvious complication from this surgery, which would then allow us to remove the stent as we have discussed earlier. We would then go ahead and do a few ultrasound scans on a monthly or 3-monthly basis, and usually after 1 year of surgery, an EC scan would be repeated to ensure that there is a normal flow of urine across the pelvi-ureteric junction. One of the most important questions that parents ask is, why does the follow-up ultrasound scan still show hydronephrosis? Well, the swelling of the kidney reduces only gradually. If you understand that a balloon, if it is overinflated, it never gets back its original shape. If the baby is small, then the original shape will come back after a few years, but in older children, it almost never comes back. So is that worrying? No. What is important is the growth of the kidney by the various measurements on ultrasound scan and the flow of the urine across the pelvi-ureteric junction as already monitored with an EC scan. Frequent EC scans are usually not required. So a mild degree of hydronephrosis may persist for many years and is not significant. So what happens to the kidney function after a pyeloplasty? Well, if there is any function which was lost before the surgery, that is unlikely to be gained because the nephrons or the factories of the kidneys may be lost permanently. However, the function usually stabilizes at this point and such kidneys may last for a very long time. The goal is long-term kidney health for both the kidneys, and even in a poorly functioning kidney, a pyeloplasty can save a lot of burden on the other kidney. What are the signs that parents should watch out for in the post-operative period after a pyeloplasty? The common problems that children may face are pain or fever or discomfort. Some of this may amount to a urinary tract infection. It is important to keep the child well hydrated and ask them to drink a lot of fluids to improve the urine output. A little bit of bleeding in the urine is expected and not to be concerned about. Over the long term, the success rate of pyeloplasty is very high. It prevents any further damage to the existing kidney, and also it completely reduces the burden on the other kidney, which allows a completely healthy normal life. It is important to keep regular follow-up to ensure early detection of any issues if they come up. So here I would like to share the story of a baby, a 4-month-old girl who came to me with a kidney function of 40% due to hydronephrosis. So this had reduced from 50%, which would be expected of a normal kidney. This baby was antenatally diagnosed to have hydronephrosis, and the scans did show a significantly dilated renal pelvis. However, the first ultrasound after birth was done within 48 hours, which showed a significantly reduced hydronephrosis, which was a fallacy. Eventually, the follow-up scans did show increasing hydronephrosis, and the child came up at 4 months with a report of a reduced renal function. The child was immediately taken up for surgery. A 3D laparoscopic pyeloplasty with a DJ stent was performed, and the child has now made an excellent recovery with good urine flow across the pelvi-ureteric junction. This case study emphasizes the importance of understanding antenatal hydronephrosis, how to work up such children in the postnatal period, when to start doing the scans and how to follow up, and how to decide whether the surgery is required or not. If you missed any of this, then we've made lots of videos in the earlier parts and the links are given below. To summarize, Pelvi-Ureteric Junction Obstruction or PUJO is a very treatable condition in children. Almost all surgery is done by laparoscopy or robotic methods. Timely surgery and follow-up give excellent results, and most children grow up to be healthy adults. So if you have more questions about any part of antenatal hydronephrosis, postnatal workup, understanding a pelvi-ureteric junction obstruction, or understanding the surgery and its outcomes, then please do write them down in the comments and we will answer them for you. Thank you for liking and subscribing our channel, and please watch out for more videos. Hello.